All right, hello.
Hi.
This is Daniel Foreman. This is my video interview. You can back up if you'd like a little bit. It's up to you. So we're going to go ahead and get started. So first, I'm going to ask, who are you?
My name is Caroline, and I'm a nurse.
Where do you work at?
I've worked at a couple hospitals in San Antonio. I've worked at Christus Santa Rosa, and I did rounds at Laurel Ridge Mental Health Hospital when I was in school, and I've also worked at University Hospital.
Which one did you like the best, and why?
I really like University the best. It's a teaching hospital, so there's always a lot of people on the floor.
Mm-hmm.
And that's interesting. They're always explaining what's happening, so it's less kind of hustle and bustle and a little more time for in instruction, education. And I really like their labor and delivery and nursery, women's health area.
Mm-hmm. Would you say it's a little bit nicer than the other hospitals?
I would say the physical, hospitals as opposed to the mental health hospitals, are the two that I worked at were about the same in terms of equipment and cleanliness and all of that. They were about the same. Our university does have a new Sky Tower, but that's not where I worked. And I've heard that that's really nice.
Interesting. That's just like a new addition to the hospital.
Yeah, there's constantly construction, but.
So the real focus of the assignment is to talk about client relationships and what that's like to have a relationship with a patient, with a client, wherever you fit along the spectrum. As being a nurse, obviously you're going to fit along the patient spectrum. Just briefly explain how you go about establishing relationships with patients that you see. What is that like?
So what they teach you in school, in nursing school, is that as soon as you walk in the door, you introduce yourself. So you say, "Hi, my name is Caroline. I'll be your nurse for today." And they have a board in the room, and there's a spot for the physician's name, nurse's name, the nurse's aide's name, a pain scale, what the day is. It kind of helps the patient stay oriented to their healthcare team, and obviously to the day, because if you're in the hospital for long stretches of time, you might lose track of where you are. It happens. And then a pain scale, that's for anyone that walks in the room. What was their sort of last check-in, if they need any medication, because that's, pain is the fifth vital sign. So it's really important that you track that. So that introduction is really important the first time you're meeting them, or if you're coming back on the floor and you're seeing them again, you're kind of reorienting them to time and place and who's taking care of them. And then I always I smile, I introduce myself to any visitors that come through, answer questions honestly, and if I don't know the answer, I don't ever make anything up. I say, let me check with someone else before I ever give out information, because I think, it's been reported in various articles that, healthcare, specifically nurses, are one of the most trusted professions out there, because I think, you're disseminating care and really intimate situation. Hospital is sometimes the worst day of somebody's life, and to be somebody calm and positive in that situation is really key. But I think honest is also another element. And then remembering who they are. You can get someone's name, and then if you come back in and you say the wrong name, that's inappropriate. So really in the first few hours of the shift, getting to know who's in what room, and every time you come in, greeting them again, because sometimes physicians, run in and run out, and they don't even say anything. It's like they're just checking the body, and they're not checking in with the person attached to it. So I think making that eye contact, explaining what you're doing, if you have the answers, giving them. If you don't, not making anything up, have been kind of key relationship building techniques. I've used.
What would you say, thanks for that, but what would you say are some of the barriers that you commonly face when establishing a client or a patient caregiver relationship? What are some of the things that maybe are difficult to separate? What are the
Sure.
difficult to move through?
I mean, a major barrier would be language.
Okay.
In Texas.
Do you speak Spanish?
I don't.
Okay.
I understand Spanish really well if it's being spoken. Like if a physician is speaking Spanish, I really understand what is being communicated, but I cannot speak it myself, and that's a goal of mine in the next, it's like a 5-year goal to really be competent in my area and to be able to communicate with patients in Texas, probably in all of the US, but particularly in Texas, I think it's key. And even if the patient speaks, I had a patient just the other day who spoke English, but her mother did not, and she was in the room the whole time, and she said, if it's okay, can everyone just speak Spanish so my mother knows what's going on? Because she couldn't really sufficiently translate, having that vocabulary, that medical vocabulary, is really key. A major barrier. Some other ones that are less straightforward would be, maybe lack of trust in the healthcare system. People that have been in and out a lot. I'll never forget one of my very first patients had been in and out of the hospital a whole lot as an adult for a couple of conditions, and he was just kind of anxious and ready to leave, and that presented a problem in terms of communication. That anxiety about being there again, looking at his chart, he's been here a lot, and you can only imagine how many people who've taken care of him, and maybe just feeling like, here we go again. It just is hard
like nothing's gonna change.
Right. So you don't know where people are coming from. When they've been in and out of the system, they may have had really subpar care. And major one would be language, and then background and education level. Another thing that you just don't know about someone from their chart is, did they finish high school? Did they have a bachelor's degree? Do they know anything about their condition? Even if somebody's had cancer for a couple of years and they've been battling it, they may just passively go through the process. They may not really know the medications they're taking or really know where they are in the disease process. And so if you make an assumption and you're treating on the assumption, they may be very lost, and that presents a huge barrier because you're not even on the same wavelength.
I can imagine how that'd be frustrating.
Yeah.
Tell me about a time when you really felt that you established a wonderfully important to you or a meaningful relationship with a patient in just the short time you cared for them.
Yeah. So actually my patient I mentioned who spoke both English and Spanish, but the mother only spoke Spanish. So I was able to really bond with her very quickly. It was my attention to her. The physicians were in and out of the room. They had interns with them that they were teaching. The charge nurse was really busy. So there was a lot going on that day, and I just had the opportunity and the time to spend with her. This was in labor and delivery, through the entire pushing process and just being at her side. And she was in pain, she wanted water, like there were things, just little things that she needed that I could be a part of, and I could help coordinate the communication with her family. And then, we went from there into starting to breastfeed with the baby, and then I took her all the way to postpartum. And sometimes there's these nursing handoffs, can you help me with the patient while I go and chart, or while I go to the bathroom, or go to get lunch. And those are necessary things, but when you have that chance to really walk with someone through a major process of care, there's a bond. There's sort of like this inexplicable kind of thing. It was her first baby as well, so I think there was the anxiety and fear coming in, and we just got a chance to be together through that, and I felt like really good about that relationship.
Fun. So on the kind of the flip side of that, have you ever been in a situation where you felt like it was maybe inappropriate to engage into a relationship with a patient? Has there ever been a moment where that's occurred?
Yes. I would say, in the psychiatric hospital, in school, they teach you to not give out your last name or any information about your family or where you live, your phone number. They said when I was working at Laurel Ridge, because this was relatively recently, they said, there are very attractive people in the mental health facility because they're just like everyone else, and you have to be very careful about establishing a therapeutic versus a social relationship. A therapeutic relationship is not one-sided, but it is focused on the patient or the client's trajectory through care, so that you have meeting times that you establish. It's not fluid. If they ask questions about you, you generally want to redirect them to them and their progress. And I think that applies anywhere. You see people in the hospital who come in who've had a heart attack or who are having a baby who also have maybe a mental illness or have suffered from depression or whatever condition. And so you're encountering that wherever, and it's really only appropriate to start with the therapeutic relationship. And if you were to see them in a public place, you cannot acknowledge their medical background. So if you meet sort of
according to HIPAA law.
HIPAA, yeah, it's because you don't know who's listening, you don't know who's around you, and the patient may be with someone who has no idea how you would know that person. Oh, this is someone you met in the hospital. I didn't know you're in the hospital, and you've created a conversation that's inappropriate and that they may not desire. So I personally haven't had that experience of someone pursuing me in a social way, but I know that just from training, from education, that the only way to really appropriately do it is in a therapeutic way. And if you happen to create a bond and become friends, you have to let the client initiate the give me your phone number or let's take a picture together. You can never do it the other way around. You never ask for contact information or seek them out in their own lives, because it's just not appropriate.
So for the last question today, kind of coming full circle, is what about the opportunity you get as a healthcare professional to develop relationships with patients that is, what would you say about those relationships that is ultimately so fulfilling for you?
I would say part of the reason that I went into healthcare was to make my life useful. I pursued something else initially in school.
What was that?
It was theater.
Oh, okay.
Performing, and I minored in psychology, so I had this sort of toe in the science world, but I was on a completely different trajectory. I wanted to perform, I wanted to travel, and had this sort of self-serving career in a way, and I really thought long and hard about how do I want to live my life? What do I want to do every day that contributes to the world? And there are lots of ways to do that, but healthcare felt like something where I got to work with people. So you're asking, what about it is fulfilling? Well, it is, you're helping people. You are with them, I think I said it earlier, on maybe the worst day of their life, or if they're having a baby, on the best day of their life. But it could it has the potential to be, it's just right on that edge of like a lot of emotions and where people need each other. You can't do any of these things by yourself. You can't go through a medical crisis alone. And so having a team of your family, of your friends, and of people who have the background knowledge and skills to take care of you, who care about your well-being, that's ultimately, I wanted to be a part of that on a regular basis. And so, you know, I get to meet not a lot of people, but, you know, a couple people every day that I'm a part of their life in a really important way. And I think that that's really special to me. And I just hope that as I continue to nurse, that I continue to be positive about it and resist that burnout where the care goes away. I want to always be on top of that for myself, just to make my career the best it can be.
Well, awesome. Just want to say thanks for your time.
You're welcome.
Thanks for sharing your wisdom. And that's all we got.
All right.
So thanks for watching. That's about it.